All right, good afternoon. Thank you for joining us again for the next weekly financial update for all the different funding opportunities for our providers in the state. As you may know, I am Catherine Ruiz. I am the ambulance rates analyst for the Bureau of EMS and Trauma. With me in the presentation, I have Paul Pedersen from Arizona Ambulance of Douglas, Jason Taylor from City of Mesa, and Ed Armijo from AMR. And presenting for us today is Shelley. So just a few housekeeping items before we jump in. I want to go ahead and remind everyone, if you hover your mouse in the center of your screen, some buttons will populate to allow you to mute your microphone or turn off your camera if you don't want to be video recorded and part of the presentation. This will be recorded and posted to our website, so for any reason you don't want to be part of the recording, be sure to turn off your camera or mute your microphone on your phone if you're calling in, or on that hover button in the middle if you are using the laptop. Next is just for the presenters, be sure as a reminder to mute yourself while others are presenting. Shelley will be presenting other materials, so we don't need to screen share. And once it is your turn to present, and if you're calling in, be sure to press *6 to unmute yourself. Thank you so much to Ms. Warren for giving us that tip from last time. All right. So first things first, for those of you that joined our call on Monday, you got a little bit of information regarding the Bureau of Financial Distributions. Unfortunately, I still have the same amount of little information available. The Bureau will be distributing, or we're looking to work towards distributing up to $500,000 through the regions. So if you have not renewed your membership to the Regional Council, I recommend you consider it. So once I know more details about that, I will absolutely present them, but that's all I know. So you know as much as I know, and once I know more, I will definitely reiterate that to everybody. Regarding the N95 cleaning the N95 masks, making sure they're no longer contaminated. Everyone might have gotten an email regarding some service that's being offered for free beginning early May. If you haven't, then you have a link there for signing up for that free service. So check that out if you have not already. And further ado, Paul, if you may.
Thank you. Good afternoon, everybody. I've got about a handful and a half of items to bring to your attention, starting out with the physician's certification statement. Those of you who do interfacility calls are familiar with this document. It requires a physician or nurse or whatever's signature to ensure getting paid from Medicare. CMS has issued guidelines that basically kind of take a little bit of the onus off us, but by not requiring them all the time during the COVID-19 time. However, two attorneys who deal full-time with Medicare issues have advised us, don't do that. Use the physician's certification statement. If you can get a signature, get one. If you can't, the recommendation is to write COVID-19 public health emergency, where the hospital rep would normally sign. There's a bit of a trust issue with what Medicare might do down the road, and the Meridian, who we get our checks from here. Secondly is I want to go over what the AAA is doing on the legislative and CMS front, trying to help us out. The number one item they're working on is to obtain from HHS existing dollars a grant of $48,000 per ambulance across the country. There's about 60,000 ambulances. They did some calculations based on losses people are seeing and came up with that $48,000 figure. They're working closely with the Secretary of HHS on trying to get some of those funds. Number two is the treatment in place. Medicare still has not addressed that. Medicare is saying that they don't have the authority to do so. Our attorneys think they do. So we're working both with CMS and with Congress to address getting reimbursed for treatment in place. Number three, fuel tax relief. This would relieve, obviously, if you're a municipality or a government agency, this doesn't apply to you, but those of us in the private sector, and maybe not for profit, I'm not sure, would be relieved of the excise taxes and would get a refund at the end of the year. So that's an issue being looked at. The public safety officer benefits, everybody is aware of the Department of Justice program when public safety officials are killed in the line of duty. That law does not cover private sector EMTs, paramedics. and we are trying to have that law extended during the COVID-19, during the public health emergency, to private providers. There has been AMR lost somebody, I think, a week ago down in Mississippi. So we're trying to get that to cover everybody during COVID-19 time. And lastly, there's a HEROES Act of 2020 has been introduced in the Congress, not by the AAA, but by some other organization. And what it would do, if passed, it would, for a 4-month period, relieve EMTs, paramedics, doctors, nurses, etc., those involved in the front line, of income tax on the first $50,000 that they make during that time, during that 4-month time period. So that's in the Congress right now as well. And then lastly, Catherine has listed a number 4, there's 4 of them, FEMA grants for the fire service. I know you all are aware of the SAFER grants, but the one that's new is the COVID-19 supplemental funding, and that has a reply by date of 15 May. So those of you in the fire service, you want to take a look at that. It does not apply to us in the private sector. Catherine.
Thank you, Paul. The other thing that I wanted to just kind of touch on is there is also the grant for adequate fire, as you know, for hiring and retention. That does also include volunteer firefighter groups. So for anyone who's on the call that's applicable to you, you might want to look into that. These hyperlinks do work. They'll lead you straight to where you can get all that information. I was not aware that this has been around, so thank you, Paul, for that. But if you have any questions regarding these applications, these phone numbers, this 866, someone does answer, and they actually answer right away. So feel free to give them a ring. I already introduced myself. Shoot them an email if you have any questions. All right. Thank you so much, Paul. Jason, if you could.
Okay, good afternoon. I'm going to spend a chunk of time following up a little more on the HHS stimulus, that second payment. And I'm not trying to beat a dead horse with this. I know I've talked about it the prior 2 meetings, but there's kind of a lot of information coming out, especially with this second round of payments. So to recap, the HHS stimulus or CARES Act for the Provider Relief Fund allocated $100 million to distribute to various healthcare providers. $50 million was a general distribution that essentially is going to ambulance providers. 30 million of that was allocated on April 17th, and that just kind of was somewhat of a surprise deposit into most providers' bank accounts. And then the second round is the remaining 20 million of that 50 million, and that started on April 24th. There's 3 major changes with this second round. The first change is that there's an application process now versus before, when it was just deposited into your account. And that application goes through what they're calling a general distribution portal. So I don't see the link to HHS's kind of hub page for this on this week's agenda, but it's been on prior week's agendas. And actually, if you just Google CARES Act Provider Relief Fund, it's the very first page that comes up. And then also this is linked in all the notices that providers are receiving from HHS about it. That will take you to, again, a hub that includes a link to the general distribution portal. So from what I understand, when you go into that portal, one of the things they're going to ask for, and this is the second of the major changes, is there's a completely new formula. They scrapped the initial formula, went with something that that HHS said was simpler, or they felt was simpler. So this is the new formula for everything. They want you to take your general patient revenue from 2018 and divide that by $2.5 trillion and then multiply that by $50 billion. That's gonna give you a figure that is intended to be your total distribution, whether it was in round 1 or round 2. So what you do is you take that number and you subtract out what you already received on April 17th. So the catch is you might get a negative number there. What that means is that you're not going to receive money in the second release. So just a heads up on that. There's kind of some confusion on what HHS means when they talk about general patient revenue. We do know that it's not limited to Medicare revenue, like the first formula seemed to suggest. HHS's frequently asked questions page says gross receipts because it's a measure of quote unquote revenues you receive during the application process. So this is unclear. I mean, I don't want to go into the nuts and bolts of gross billing versus your net billing or net collections. In my opinion, I would err on the conservative side with this, though, considering HHS said to focus on what's a measure of revenues received. That to me is different than what was billed. So that's just my 2 cents on that. The third major change is that when you go into that general distribution portal, you're going to be asked to estimate your lost revenues for March and April as a result of COVID-19. Again, on HHS's frequently asked questions page, they're saying that they're just looking for something reasonable here. In fact, to quote them, you may use a reasonable method of estimating the revenue during March and April compared to the same period had COVID-19 not appeared. I know they're giving some examples, but really the general guidance is it's going to be a little different for each provider. If you've had a lot of changes or growth in your program, or even declines in your program that were not related to COVID-19, then I would caution you to follow what method seems to make sense for how your business model has changed. And again, they're just looking for a reasonable estimate. And I think ultimately, if you don't think you've been impacted by COVID-19, or you've been impacted to a much lesser degree than how much money you might receive, then again, I would caution you to follow reason and avoiding the appearance of a money grab with that if it's not justified, because HHS is starting to make it clear that they're going to circle back and audit the receipts of these monies, so, and how they're spent. And then just one final thing on this, and I'll move on to the other parts under my portion of the agenda. Actually, I just lost my train of thought, so I'm going to just go ahead and move on to the second parts of the agenda. My apologies.
If I can interrupt you before you do, just so that we get this note with your section. Sorry, Jason, I apologize.
No worries.
We also have a note in the chat box, I know you're calling in today, that says that they also want you to upload IRS tax forms, but special districts do not file taxes. So that seems to be a challenge. Paul's already responded and stated that AAA would then recommend uploading an audit report. But the concern is that's not what they're asking for. So I don't know if anyone else has run into this situation.
So as I often do, and I'm, I am going to give a plug for AAA. They have had one specific webinar on this second round of distributions, and they're going to have another one on, I believe it's the 7th, May 7th, specifically for governmental providers. And in their first webinar, they did say that HHS is asking for your last audited financial statements to be uploaded if you're a governmental entity. There were some little hiccups in the portal, and hopefully the AAA addresses that in their next webinar. And that webinar is available for free for members, and for, I believe it's typically $150 for non-members. And that actually, thank you, Catherine. That was the other piece that I lost my train of thought on. So I'm glad you jumped in.
Thank you. Next item, I guess. Thank you.
Okay. Yep. So then 2 other grant opportunities that I'm presenting on, but Catherine found these. So Catherine, if I misspeak, please jump in and correct me. The first one is the U.S. Department of Justice Coronavirus Emergency Supplemental Funding grant. It's a grant to provide funding to assist eligible states, local units of government, and tribes in preparing for, and responding to the coronavirus. And they also mentioned that would include addressing medical needs of inmates in prisons, jails, and detention centers. So this is only available to entities listed within this. Let's see, Shelley, do you have this on the screen right now?
She does, if you keep scrolling. The next page, Shelley, please, if you could. Got a green heading. This page.
Okay, so this is the BJA fiscal year 2020 coronavirus emergency supplemental funding sheet. So Catherine has links in all of these in the agenda items. So you don't have to go looking for this. Go to this portion of the agenda item. It'll bring you to what Shelley has on the page. And these are the entities that are eligible for this grant. But really the key is that these entities can pass through to subawardees. So all ambulance providers can approach their local municipality, county, or tribe and request a subaward of this grant. So that's the key. If you're not listed here, I mean, this obviously doesn't list ambulance providers, but if you're in the jurisdiction of one of these entities, then you can approach them for a subaward. The deadline for this grant is May 29th. From what I can tell on the website, Shelley, I don't know if you're able to scroll up to the top of this page. This is where I saw some of this, but as I'm talking, it looks like they've only awarded about 170 out of an anticipated 1,900 awards for this. So looks like there's plenty available from what I can tell. And then if you have any questions about applying and the subawards, Catherine has also succinctly included those in links embedded within the agenda there. And then
those phone numbers and links do work, and those emails work as well too. So if you have questions, don't hesitate to reach out to them. They do answer.
Always refreshing. Okay, and then the last one is item 3C there, the Arizona Criminal Justice Grant. This one is not available yet, but it is coming soon. From what we understand, it's available to everyone for COVID-19 response, but there's a priority for all providers who currently or may soon serve prisons, jails, detention centers, etc. So the link that Catherine has in the agenda takes you to where you can register for the grant portal and the newsletter so that you are notified when that becomes available and you can expedite your application for that grant. And absent any questions, that's, I believe it's Ed's turn.
Thank you, Jason. Thank you so much. Just to kind of piggyback on what Jason was stating, if you are the local provider for a jail, even if you don't have a contract with them, you could use that as justification as to why you're eligible for this criminal justice grant. I know some different providers do have contracts to help serve the population who are incarcerated or in holding, and you are definitely eligible. You are at the top of a very short list when it comes to being eligible for this grant that will come available. And I would recommend apply. Even if you're not at the top of that short list, you can apply as well too, because you could say, hey, I have Florence Prison in my service area. So because of that, you might need me at some point. So this is why I should be eligible for it. Just be sure, we've said this before, we'll say it again. Jason's definitely been very good about reiterating this. Ensure you're not double dipping. Don't claim expense on an SBA loan and a Fema loan, and now some other grant that we're doing as well too. So just be wary of that when you're applying for these. All right, Ed, if you could please.
Sure. On my portion, I have 3 items. The first one is 4A, which is Arizona Complete COVID-19 Grant. This is an organization called Arizona Complete Health, and they provide funds for nonprofit entities. If you click on that website, it's going to take you to the location of the process. Things that you want to know for sure are the examples of their priorities, and that includes expanding wellness and prevention efforts. And then on our part, it's addressing social determinants of health, which includes health and safety for the community, your community. It specifically identifies that it's for 501c3, 501c19, tribal nations, and any Arizona governmental entity, they can apply for this grant. If you look at the right there, right after that statement on the second page, it says types of community investments. You hit that little plus. They have amended their program to include that you can apply for funds, but you have to do it between April 27th and May 8th, and that will be directly related to COVID-19 pandemic. Then it follows with a reminder that anything after that would be applications that they would ask you to apply for, and so it's restricted after that. We believe that currently anybody in those sections, 401c, nonprofits, and so on, can apply for this grant. You want to go back to down the page to the community reinvestment application process. It provides at the end contact information specifically, so you can either email or call these individuals, specifically email. And then at the end of the contract, it says how to apply, and it gives common grant applications, and it gives information on exactly how you can apply for this grant. It's got a requirement that you go as a first-time user, you create a username and a login, and then after that, it provides you the opportunity to file your application with them. The second item was under Arizona Community Foundation. They're providing information for nonprofit organizations. They're providing funds for nonprofit organizations for immediate relief and long-term recovery grants for COVID-19. If you look on the third page or the second page, it has the grant guidelines. You want to click on that guidelines so that you can see what those guidelines include. Page 1 of those guidelines is uses for the funds. Page 2, eligible organizations. And then page 3, grant terms and conditions. You need to make sure you look at those and then fill out that application that follows in this page, which is Arizona COVID-19 Community Response Fund application. Last part that I was doing was the guidance links. The first one is the Tribal Communities Guidance link that gives you some guidance as a tribal entity for funeral and burial services and social distancing. The infection control guidance for health professionals. It provides guidance on infection control, PPE, and those other items under that category. And also, they provide guidance specifically by type of facility that follows on that one page. Preparedness tools for health professionals and facility responding to COVID-19. That's little II or number 3. That one's specific. That's clarified by just its title. The second title, Standard Operating Procedures, SOP for triage for suspected COVID-19 patients. And that's exactly what it is. It gives that information for you. Public health communication, getting your community ready. That's for public health officials, for health communication specialists, for health educators, and so on. And they provide specifics on the variety of issues that you're responsible for providing information to the community and give you some guidance on that. The last one is the interim U.S. guidance for risk assessment and public engagement of healthcare professional potential exposure. It's a recent publication. It actually was put out updated on April 12th and put out on April 15th. You want to go in and look at that if you haven't looked at it before. And all of these come from the CDC. That's it.
Thank you so much. There's a lot more new and updated CDC links. So these are just a few of them that I snagged and had Ed present to us. But there's a lot more there. So feel free to visit the CDC website if you haven't done it recently. There might be some new information there that would be helpful. And there might be some updated information that is now more elaborate. Just to kind of piggyback on the Arizona Community Foundation grant that we were talking about, the second grant that Ed mentioned, that is available for those of you who've experienced revenue loss due to cancellation of programs or revenue loss due to disruption of services, which is pretty much everyone in the state. The only thing about that grant that's a little bit misleading is it does pitch as if it's an immediate payment, but in that grant guidelines, it states distribution of funds would not happen until after the state of emergency expires. Now, of course, that is subject to change if they get so many applications that state that they need help now, not 6 to 9 months down the road, or however long we're going to be doing this for. I don't know if it's 6 to 9 months. I'm just using it as an example. So I don't know if that might change. We'll see. But I did read that in the community guidelines, but hopefully it is incorrect or I misinterpreted it. Last thing for the closing remarks here, all previous presentations and resources are uploaded to our ground ambulance homepage. Our web team has been stellar about getting these turned around quickly to put them online so that all this information can be shared. So that's been great. I'm also going to create a master list of all previously distributed funding opportunities. I've been approached by many different people saying that they would love to have a list of everything with dates and links and everything so that it's pretty much one-stop shopping. So I will work on that and hopefully get that on the website within the next couple days. And that will also be on the Ground Ambulance homepage. After we present all these opportunities, I will continue updating it. The last thing is we still have information on the 911 resource page. And we also have a lot of our resources in Spanish. So for those of you who have Spanish-speaking populations, you might consider maybe sending out a little blurb about how that link specifically there will turn all the tabs on the Arizona Department of website, COVID-specific information to Spanish. All the banners, everything has been interpreted. So maybe this would be helpful for those of you who have populations of Spanish-speaking people. And last but not least, we still have the EMS website. If you have any questions, feel free to use that. Some of this CDC information is repeated on our Arizona Department of Health Healthcare Providers and Facility Partners webpage. The hyperlink is there as well. So feel free to check that out if you haven't already. So if you have any questions, feel free to *6, unmute yourself and ask, or type it into the chat box. I guess not. All right, then if there's no questions, then thank you so much for joining us. Pretty much 30 minutes on the dot. I'm pretty proud of ourselves for getting through all this in such a great amount of time. So thank you all. Have a great day, and we'll see you next week.